Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department. And I would like to acknowledge that today marks actually the 1 year of our press briefings related to COVID-19. It has been a very unique year, and I don't think a lot of us expected to be in this situation ever in our career, but even right now. So with that, I'll start with the current case counts for the Tri-County. For Peoria, Tazewell, and Woodford, we sit at 34,477 cases to date. Again, that's 34,477 cases to date. That's an increase of 341 over the past week. The last time we saw a value around 300 for cases increased in over a week was actually July 29th of 2020. So we have, again, been trending in the right direction, and hopefully we can continue to do so. Peoria now sits at 17,092 cases, with an increase of 120 over the past week. Tazewell County at 13,644, an increase of 168 over the past week. And Woodford County is at 3,741, which is an increase of 53. Our to-date total for deaths sits at 585. That is an increase of 31. That includes 1 death in Tazewell County, bringing it to 236. Woodford remains at 64 over the past week, and Peoria increased by 30 to 285. I did want to address this. I believe it was shared as part of the press releases. Depending on how death data is reported to us or when the individual passed away, it is put on a death certificate. This is processed through the Illinois Vital Records, or IVRS, system. That also feeds into our database. So even after the 10 days of our investigation, and then we no longer actively investigate because they're no longer considered a case but recovered, they still have, as the coroner explained in one of our briefings, a time period where they'll actually do a review over the death certificate. If COVID-19 is listed either as primary, secondary, or tertiary, or even contributing, it will then be uploaded into our system based on IVRS. So by doing these case reviews, we were able to identify those additional cases that came through. That also includes recently 1 death since yesterday in Peoria County to a female in her 70s from Cornerstone. Our 7-day average now sits at 49 new cases. And again, to give perspective, the last time we were seeing 49 new cases in the Tri-County as our 7-day average was on July 30th of 2020. In regards to our hospital data, we currently have 2 cases in the ICU, 20 cases in the non-ICU, and 1 death to report in the past 24 hours. The 7-day average for ICUs now sits at 5 beds in use, and the med-surg now is at 21. One of the biggest news that we want to indicate in the Tri-County, and you may have seen this already, we started sharing this information, but tomorrow the Tri-County will be moving to the expanded 1B+. This includes persons aged 16 to 64 with medical conditions that increase the risk of severe COVID-19. Again, not all medical conditions, but those that increase the risk for severe COVID-19. These conditions include obesity, diabetes, pulmonary disease, smoking, heart conditions, chronic kidney disease, cancer, solid organ transplant, sickle cell disease, pregnancy, and persons with disabilities not otherwise covered. One of the key partners we've had in this response for over a year has been 211. They've helped us to provide information during the early stages of the pandemic about getting resources. They continue to offer that service. And as we now transition to 1B+, we recognize that there is a need for more information, specifically accessing appointments for the vaccine. And so with that, we're going to be looking at 211 to assist with that. And we have with us Jennifer Zametta, President of Heart of Illinois United Way.
Thank you, Monica. The Heart of Illinois United Way is proud to offer the community our 211 information and referral line, run by the very professional team at AMT. 211 is a health and human services community database. We cover Peoria, Tazewell, Woodford, Marshall, Putnam, and Stark counties. And we take almost 12,000 calls a year to provide people with non-medical emergencies with referrals to fit those needs. Through our database, we guide people to community clinics, mental health and substance abuse treatment, housing, financial assistance, domestic violence support, clothing, food pantries, and much more. 211 is free, it's confidential, and it helps thousands of people find help every year. 211 is committed to providing real-time and accurate information to our callers, and as the pandemic has unfolded, that's become even more important. In keeping in that theme, 211 is excited to partner with the Peoria City County Health Department as they continue their vaccination rollout. Beginning tomorrow, Friday, March 5th, individuals that fit the 1A and 1B state vaccination schedule that have yet to receive their first dose vaccination can call 211 to be placed on the first dose saver list. As Monica stated, this does include the expansion group with the specified medical conditions. 211 will be available to complete the first dose saver survey from 8 a.m. to 6 p.m. Monday through Friday. Some phone providers do not correctly route calls to 211. If you can't get through by simply dialing 211, we have an alternate number. That number is 309-999-4029. I'll say that number again, 309-999-4029. A few items to note. If you've already contacted the health department, you are already on the first dose saver list, and you do not need to call 211 to be added. If your healthcare provider or other vaccine location you signed up for calls you with a vaccine opportunity, please take that appointment. The first dose saver list is not a guarantee of an appointment. Once you are on the first dose saver list, you may be called on short notice when an appointment becomes available. You need to receive your second dose the same location you receive your first dose. And finally, to ensure the phone lines for this collaboration are used efficiently, 211 is asking that if you have internet access, you complete a short survey at home by visiting the Peoria City County Health Department's website. And if you need guidance to do that survey, 211 is happy to walk you through the process over the phone. Thank you.
Thank you, Jennifer. We'll open up to some questions.
So if we move to the 1B plus, where are we at in that 65 plus? Are we completed now with that?
I wouldn't say we're completed. I think we actually have a good handle of it. We at the Tri-County region, Peoria, Tazewell, and Woodford, have been working with our hospital systems and our federally qualified health center, Heartland, to help us focus on that 65 and older population. Through those communications, they've done a fantastic job outreaching to their clients and setting them up with appointments. And so right now we're seeing over 50% of those outreaches actually have now been vaccinated or now having appointments being done. So we feel like we have a good handle on it, and we have pending vaccine coming in to take care of those kind of final appointments. We know it's not going to be perfect. We know that not everyone has necessarily reached it. We didn't expect to get to 100%. It would have been lovely to. But we have a good enough handle to recognize that it's good to now move to the next phase.
You didn't open it up to begin with because you didn't have enough vaccine. Have things changed? Are you getting more vaccine now?
Yes, so we initially were hesitant because our first dose allocation was a lot less. Now overall we had a lot of second doses coming in, which were helping us get those fully vaccinated individuals in. We're now seeing our first dose allocation increase across the board, and we hope to see from projections that they continue to increase. This week alone we received 1,700 doses as first doses. We hope to get another 3,000 next week, and then after that the projections tend to see as an increase as well. And this was expected. Both Pfizer and Moderna have been working diligently, and now we know that Johnson & Johnson has arrived into our state as well. So we hope to see Johnson & Johnson allocations in the weeks to come.
How will you prioritize who receives Johnson & Johnson? I mean, is there going to be a way to risk to say, you know, you should get the single dose versus the 2-dose?
So I don't know to say we're prioritizing. I think whatever vaccine we have is the one that we're going to be pushing out. All 3 vaccines are effective, and I think that's important to know. A lot of people sometimes see the Johnson & Johnson and focus on that 65% value and think that for some reason it's not as effective as the other vaccines, and that's far from it. If you go into the details for each of the vaccines, they're actually broken down further from hospitalizations, death, severe illness, and all 3 are really very much comparable in terms of We saw no deaths in all of them 4 weeks out. Same with severe hospitalizations as well. So they're really effective. The difference also is that Johnson & Johnson was tested against variants that are now available. Again, Pfizer and Moderna being slightly older, right? So they're testing against different types as well. So that 65 is not a reason to think of it as a subpar vaccine. In fact, it is a very strong vaccine, and we will communicate with people what vaccine we have available. But at the same time, if you have the opportunity, get one of them.
Has Peoria received any of the Johnson & Johnson allotment yet? And if not, do you know when that will happen?
So the question is whether or not Peoria or even the Tri-County has received the Johnson & Johnson allocations yet. No, we have not. The first allocation to the state actually arrived this week, and then we are hoping that in subsequent weeks we will start seeing them come in.
So knowing the way that Peoria County has been distributing vaccines kind of through your health partners, the hospitals, and Heartland, I mean, we know OSF has said they've got some reservations, more reservations about the J&J, so that's not their preferred option. Are you going to distribute J&J through them, or are you going to route it more towards Unity Point and Heartland?
I think it's too early to tell, especially if Johnson & Johnson becomes the only vaccine that we have available for a certain time. But I think that we're going to recognize the needs and the concerns of all of our partner agencies. We don't want to put them into any uncomfortable positions. But again, I think the great part about Johnson & Johnson is a one-dose vaccine. And with that, it blends itself to kind of a different type of model of service. So you're going to see a lot more Johnson & Johnson at these mass vaccines, especially these drive-through clinics. And I think you're going to see it targeted there first because it's easy, it's accessible, and quick. So we might be actually using Johnson & Johnson in a different type of delivery method because of the flexibility of it, while the Moderna and Pfizer might still continue to be in our hospital systems, not because necessarily the hospital system's request, but because the follow-up and the storage mechanisms make it a better environment to distribute the Moderna and Pfizer through the hospitals.
So when you say different delivery method here locally, I mean, are we talking establishing a max vax site for the Johnson & Johnson here in Peoria?
I think those are going to be dependent on how much vaccine we get before we start doing these mass vaccination sites. But what we are seeing with Johnson & Johnson is they're really good at drive-through clinics, which we don't have in our area. And so if we see a lot of allocation for Johnson & Johnson, that would be something that we would stand up as one of our options. And the health departments all have history with drive-through clinics. We actually use it for influenza a lot. And so, again, depending on allocation, we're going to kind of work through that process.
So how would that look? Would that be kind of exactly like the drive-through clinic for testing you had set up out here last year, where you're in your car, you drive up, stick your arm out the window, and they have a needle in?
Well, we'd like to also park the car too as well, hopefully. Yeah. We've learned that lesson in flu clinics. But we would still try to have people do their consent forms, register similarly, make sure that paperwork is done. But yeah, really come through in their car, park their car, go through their data, look at contraindications, and then vaccinate them, and then let them go on their way. And again, because it's only one dose, we don't have to work about creating a second dose appointment.
If all three vaccines were available, how is it decided which one a person would get? Would they get to choose, or is that up to healthcare providers or people like that?
The question is, if we have all three available at once, how does that kind of option work? We're going to be looking really at when the vaccine arrived. Some of them expire or need to be used at a different time frame, how long they can be stayed in storage. So we're going to be trying to push them out so that we don't waste. I think it's not going to be necessarily dependent on the individual. I think that maybe the biggest difference for the individual is a 16-year-old or a 17-year-old, because 16 and 17-year-olds are currently only available to get the Pfizer. Otherwise, Moderna and Johnson & Johnson are for 18 and older. So that may be the only real indication change. Otherwise, it's going to be what makes sense so that we don't waste a single dose.
Your website for vaccinations, was there a glitch this week because it quit taking, it usually is up even when it doesn't have appointments, and it went down, it sort of disappeared this week. Is there something going on with that?
The glitch that happened was because we were updating it for the expansion group.
Okay.
And it should be back up line.
I wanted to kind of ask a question. It's a little off where we've been talking, but you did a vaccine hesitancy town hall. You moderated that earlier this week, and the surveys just come out from a couple different universities. Civics did one, which is a polling group, and then Monmouth University, I think, did another one, which says that a lot of the Caucasian Republicans have the most hesitancy. I mean, is that something you guys have talked about and strategized around?
So we've done a vaccine hesitancy survey here locally, and we've actually tried to understand kind of what those distinctions are. And I think Dr. Ezike actually said it really well in our panel discussion, which is vaccine hesitancy means a lot to different people. It could be mistrust in government. It could be mistrust in medicine. It could be just not right now. And so I think we need to, in our survey, even showed those results as we are kind of analyzing the data as we speak, that we're going to have multiple approaches to handle this, because right now we're in the sweet spot. Limited supply, high demand, where you can't get enough of it. And we know in the summertime when it starts trickling down, when we have a lot of supply, the demand's going to go down, and if we're not hitting those marks that we want for herd immunity, there's going to be a lot of energy. So that's why Peoria City County Health Department put out that vaccine survey so that we could start getting ahead of it early. But it can be a variety of reasons, and so I wouldn't be surprised if concerns around government, political party, or just, again, the how the science even works are going to be all things that we have to address.
Calling 211 tomorrow, would that be just to be put on the first dose saver list, or is that